For this portion of the assessment, we will be focusing on the abdomen. And when we assess the abdomen, we change the order of assessment. We will be inspecting first, auscultating second, percussing third, and palpating fourth. So at a glance, we note the abdomen. There is the skin looks normal. There's no lesions. There's no masses that are visible or protrusions. There's no scarring. The patient's abdomen is symmetrical. It is flat. It is non-distended. Then the skin color is uniform. The umbilicus looks normal. It is uh, inverted with no pulsations that are absorbable. So after having inspected his abdomen, we're going to go ahead and listen to it. We're going to listen to all four quadrants for 1 whole minute, but for time we are not going to do the whole minute. Let us start. We're going to start in the right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. So all four quadrants are active for bowel sounds. They are hyperactive actually in some parts. And so we would also go ahead and we could go ahead and auscultate for the aortic vessel that comes down through the abdomen, the renal arteries, the iliac, and the femoral. The aortic artery is below the xiphoid process and above the umbilicus. We would listen with the bell of the stethoscope, and we're listening for bruits, which is like a swishing sound. There's no bruit present in the aortic. Then we go down to the renal, which is to the right, to the sides of the aorta. There's no bruit present in the right renal, no bruit present in the left renal. And then below the umbilicus is the iliac arteries, and we also take for bruits. There is no bruit present in the left iliac or the right iliac, and we could also check femoral, which is lower in his abdomen. His right femoral and his left femoral both are absent of bruits. And so after having auscultated, we are going to go ahead and percuss. We are percussing the abdomen, noting the difference between the gas pockets in the intestine and the borders of his liver. After having percussed his abdomen, we are going to do some light palpation starting in the lower quadrant, noting for any masses, lumps, or tenderness, if there's any guarding, if there's rebound tenderness, especially in McBurney's point, and just asking, does this hurt? Do you feel any pain? And so we go about 2 centimeters in, palpating every quadrant. Then we could switch to deeper palpation, which goes down to like 4 to 5 centimeters, and we ask them if there's any pain. and we could feel the liver on his right side, which feels round and firm. So there was no lumps, no masses, no tenderness. We're going to go ahead and take advantage and do the hooking technique to assess and palpate his liver. So we are going to ask him to take a deep breath, and when he does, we are going to hook up to palpate the borders of the liver. So can you take a deep breath for me? And standing to the right, you use the pads of your finger. Okay. Take another deep breath. So there's no enlargement of the liver, and it is around the mid clavicular line. So that concludes our abdomen assessment.